everyone. I'm Dr. Michelle Halyard. I'm a member of Alpha Kappa Alpha Sorority, Delta Beta Omega chapter, and the breast cancer subcommittee of the chapter. And I am also a practicing radiation oncologist at Mayo Clinic. So I'm here today to talk with you about breast cancer and breast awareness. October is Breast Cancer Awareness Month, and over the next 4 weeks, I'll be bringing to you information regarding breast awareness, what to look for signs and symptoms of breast cancer, the importance of mammography and what to expect. We'll also be talking with you about what to do if you're diagnosed with breast cancer, as well as resources for breast cancer patients and their supporters. 1 in 8 women are diagnosed with breast cancer in her lifetime. Although breast cancer usually occurs at older ages, somewhere in the late 50s to 60s or higher, it can occur in younger women too, particularly Black women who are more prone to developing what we call triple negative breast cancer, which is a particularly aggressive form of breast cancer that can occur even in 30s. And sometimes women can develop breast cancer even in their 20s, depending on their family history. Don't forget, men can get breast cancer too. Early diagnosis and treatment is the key to surviving breast cancer. And there are thousands of women that are not only surviving, but thriving as well. So just what do you need to know? First, you need to know what's normal for your body. There isn't a recommendation anymore to do monthly breast self-exams, but it is important for you to know if something has changed in your breast. Seek evaluation if you know any lumps or thickening or hard areas or any areas in your breast that are different than before. It's really important to understand that breast cancer does not present or feel in just one way. So the key is knowing what's normal for you and seeking medical attention if something has changed. Some women can develop cysts, which are benign, and indeed about 70% of the things that we feel on our breast are not cancer. So that should give you some comfort, but you need to understand what's normal for you. I recommend examining your breasts both lying on the bed when they're dry and don't have anything on them, but also examining in the shower when your fingers are slippery and soapy and you can feel things better sometime. You should also look at your breast in the mirror and see, has there been a change in the size or shape of one of them? Do you notice any pulling in of the nipple? Any change in color, such as redness or purple change, or thickening of the skin? If these are different, they should be investigated. It's also important to know your family history. Many women will say to me, I don't have a family history of breast cancer, so I'm not at risk. But that's not true. Only 5 to 10% of patients who are diagnosed with breast cancer have a family-related genetic change that predisposes them to breast cancer. However, if you do have a breast cancer where you have a number of people with breast and ovarian cancer, as well as some other cancers, and particularly early age at onset, it's important to let your healthcare provider know that because you may be at increased risk too. So know what the recommendations are for getting a mammogram depending on your age. And we're going to be talking about that next week, so please stay tuned. Hopefully, this information about breast awareness and what to look for in your breast has been helpful. Please pass it along to others and take the information to heart yourself. Thanks for listening, and remember that knowledge is power. Knowledge of what's normal for your body is powerful, and knowledge that if anything is wrong, you should seek care from a healthcare professional. Look forward to talking with you next week about mammograms. Thank you.